Lawmakers are warning about the potential dangers of nicotine pouches gaining attention on social media. Zyn pouches tucked discreetly between your lips and gums. Now concerns are growing about safety and access for children and teens. Eva Pilgrim has more.
Calls to crack down on a social media craze, a product marketed as a tobacco-free alternative for getting that nicotine hit. Small nicotine pouches that dissolve in the mouth. Zyn, the Swedish brand of nicotine pouches popular in Europe, now taking hold in the United States with the help of so-called Zynfluencers on TikTok. The hashtag Zyn amassing more than 700 million views on the app and gaining the attention of Gen Z, some of whom are under the age of 18. The CDC reporting that sales of nicotine pouches have rapidly increased in recent years, with data from 2023 showing 1.7% of high schoolers reporting use in the past 30 days. Senate Majority Leader Chuck Schumer, who has led the charge against vapes and e-cigarettes being marketed to children, now setting his sights on nicotine pouches.
A simple search of social media for Zyn will generate an eye-popping amount of content. Most of you probably haven't heard of it, but your kids probably have.
And while these pouches contain a smaller amount of the highly addictive drug compared to traditional cigarettes, medical experts say it is too early to tell what the long-term health effects could be for kids, but add that individuals who are nicotine naive, especially young individuals, can be at risk for acute nicotine toxicity if consumed in high amounts, which may cause agitation, fast heart rate, and vomiting. Prolonged nicotine use can also increase the risk of cardiovascular and respiratory disorders.
If you take kids that are in their teenage years and you make them lifelong users 4 or 5 decades later, I don't know what the health consequences would be.
The parent company of Zyn, Philip Morris International, telling ABC News, Zyn is designed for adults age 21 or older who are currently using nicotine products and wish to continue using nicotine. Our marketing practices, which prohibit the use of social media influencers, are focused on preventing underage access and set the benchmark for the industry.
Eva Pilgrim, thank you. And ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, is joining me now for more. Dr. Patel, what do parents need to know about Zyn?
I think it's important for parents to be aware that the product exists, that it's accessible. Even if you have to go to a store and show ID, you can buy it from third-party websites. And kids are unfortunately passing this around at school. We've already seen some cases of kids who report toxicity from taking these pouches. And parents should also know that, yes, there is a lot of marketing out there that's protecting kids against the dangers of e-cigs and traditional combustible cigarettes. But there are an entire population of kids and teens who are hearing from influencers online about the benefits of nicotine for improved concentration and focus. We have to make sure that we're also teaching kids about the dangers as well, especially on their developing brains.
Now, Eva mentioned a risk for acute nicotine toxicity. How does that happen, and what are some symptoms to watch out for?
You know, these pouches, depending on the type that you buy, each one could range between a couple milligrams of nicotine to upwards of 15 milligrams, which I personally have seen some of those being sold. Now, a young child could get symptoms of nicotine toxicity with as little as 1 to 2 milligrams and could present with agitation, nausea, vomiting, or worse. So it's really important we protect all those little children, everyone, from nicotine.
And before I let you go, Dr. Patel, I want to ask you about measles, because there are outbreaks growing across the U.S. So what do people need to know, and how can we protect ourselves?
And we eliminated measles in the year 2000 because we have a very effective vaccine that's over 95% effective. So people need to understand is that measles is so incredibly contagious that if one person has it and coughs or sneezes, 9 out of 10 people around that individual, if they aren't protected, could catch measles. And measles itself, 1 out of 5 kids who aren't protected may become hospitalized. 1 in 1,000 could get brain swelling. And if that doesn't cause severe long-term illness, it can unfortunately cause death. So it's really important that parents out there pay attention to these gaps in immunization, which exist for a variety of reasons, and they make sure their kids are caught up on all childhood vaccines, including measles.
All right, Dr. Alok Patel, thank you. And if you or someone you know is struggling with nicotine addiction or other substance use or mental health concerns, free confidential help is available 24 hours a day, 7 days a week at 1-800-662-HELP.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.